Okay, everybody. Well, thank you for just holding on. We just waited for a few more people to join, and there may be a few more as we get going. So, firstly, introductions. My name is Chris Manning. I'm one of the directors at MedFac UK. Alongside me, we've got wonderful Keely, who is our IT expert and makes sure that this webinar runs smoothly. But most importantly, we're absolutely delighted to have Liz Gwynn with us today. She's our special guest presenter and is a true expert in GripAble. So we're hoping over the next 35 minutes or so, you'll have a really fantastic overview of what GripAble can do. Just a few bits of housekeeping for you all. Please note that this session is being recorded. So if you do want to reference back to it at any points or any slides, then you can go back into it at a later date, and it will be on our MedFac Learning Centre portal. In terms of asking questions, there's going to be time at the end. So the way we'll run it is that Liz will run through her presentation talking about GripAble, and there'll be a few minutes at the end for questions. So if you do have any questions, if you could use the chat function on the bottom bar for this, and then we will try and answer as many questions as we can within this time scale of this webinar. If we don't quite get round to you, we'll do apologise, and we will answer them subsequently after after this webinar. Um, all of your delegate microphones will be muted throughout, so I do apologise if you want to ask a question verbally or something. You won't be heard, so just be aware of that. And the other element to note, just to reinforce, this is being recorded, so you do get access to it after this session. Okay, so just before I hand over to Liz, this is really just a continuation of our webinar series that we've been running now since the start of the year. We've done splinting webinars with Ella Donnison. We've also done an introduction to casting with Camilla Mal from Sweden. And as part of our sort of focus on hand therapy with our webinars, we're now going to have a really interesting session with Liz looking at GripAble. So, without further ado, I'm going to shut up, turn off my microphone and my video, and pass over to Liz. Take it away, Liz.
Thanks, Chris. Hi, everyone. Hopefully, I can live up to Chris's introduction. As Chris said, I'm Liz. I am an occupational therapist, and I've been specialising in upper limb rehab for about 15 years now. My focus is predominantly in trauma and orthopedics. I currently work independently as both a hand therapist and as a rehab case manager, and that's again predominantly within litigation and like medical legal context. But the reason I'm here today is because I was fortunate to work closely with a fantastic team at GripAble, where I led clinical operations and helped develop ways to integrate GripAble into real world practice. And I'm going to say these days I still use it regularly in my own clinical work, as I have a particular interest in how we as therapists can harness tech to enhance our practice and our clients' rehab. So yeah, really pleased to be here today and hopefully share what I've learned and offer some practical insights into how GripAble might support you and your patients. So I think that's next slide. Kaylee, thanks. So what can you expect to take away from this webinar today? Well, I'm going to start by introducing GripAble, what it is, how it works, some of those key features. And then just explore briefly the key rehabilitation principles that underpin it, and then look at how it can be used in practice across a range of patient groups. We're going to be looking at hand therapy, neuro rehab, pediatric, and older adult populations. And then we'll also just touch on how you can begin integrating it into your own clinical kind of caseloads or context. And as Chris said, we're going to finish with some time for questions and discussion. So please do share your thoughts and ideas. Just to say, this is very much a whistle-stop tool. There are many, many creative and nuanced ways you can use GripAble, but tonight we're just focusing on the fundamentals, just enough to get you started and hopefully spark a bit of curiosity. And hopefully this will be the first of several sessions where we can dive a bit deeper into kind of some more real case examples and some clinical reasoning with it. Okay, thanks, Kaylee. Next slide. Okay, so what is GripAble? Next slide. So GripAble is a portable app-based rehab platform, and it's designed to support both assessment and training of the hand and wrist across a wide spectrum of clinical needs. At the heart of the system, we've got this lightweight handheld device. It's just about 240 grams, so it's really quite light. And it connects via Bluetooth to the GripAble app, which can be downloaded for free onto your tablet or smartphone. The device detects four key upper limb movement. We have grip and release. We have wrist flexion and extension. We have ulnar deviation and ulnar and radial deviation, sorry. And we've got supination and pronation. In addition to movement tracking, the device also functions as a validated digital dynamometer. And we're going to talk about that in a bit more detail in a minute. Within the app, we've got 14 gamified therapeutic activities, which all have been built with rehab goals in mind. And we've got 6 structured grip strength assessments. And these are aligned with clinical standards using the American Society of Hand Therapy recommendations. It's important to highlight that all these games, again, like I say, the activities have been designed to support a wide range of therapy goals. Some of these games are going to focus a bit more on your high repetition, ideal for driving neuroplasticity and motor relearning. And then the others are geared more towards like your sustained grip, precise control, or improving accuracy. Cognitively, the games also vary. Some are very simple and great for early engagement, while others are more complex and demand a bit more attention, a bit of problem solving, or some quicker reactions. So it's great. GripAble can be used for both physical and cognitive rehab. And also in terms of feedback, the games have several scoring systems. Some based on accuracy, others on time. We've also got multiplayer options to bring elements of social connection or a bit of friendly competition. And that's particularly useful with your pediatric or group rehab settings. Okay, next slide. Thanks. So, as well as their built-in increased challenge through the different levels, they get harder as they go through. GripAble can also be calibrated to an individual's abilities, and this is the really great bit actually about GripAble. So, when you first set up the device, the app will ask you to measure the patient's available wrist range of motion and their grip release. And then this information is then used to scale each activity to the individual's current ability. So whether you're working with a patient who has just 20% of wrist range post-fracture, or someone with minimal voluntary grip activation post-stroke, or even if you've just got a high-functioning client with full grip strength and control, the system's going to adjust the parameters to provide the activity that's achievable, but still therapeutically challenging. And I think we've got a video here to show just. This shows you how quick and easy it is to calibrate the device. And you can see here it's working. It measures the grip and the release. Okay. So this calibration can be repeated at any point. So it makes it really great for like progress reviews, adjusting therapy plans, or reacting to any kind of clinical fluctuations. So for instance, if your patient's got fatigue or change in pain or tone. And then from a clinical perspective, this is great because it ensures that we can reduce that frustration for patients who are early in their journey. We can provide progressive overload as ability improves, and we get consistent patient success and motivation. Okay, next slide, please. Okay, so as I mentioned earlier, GripAble functions as a digital dynamometer, and it's highly sensitive and it's backed by solid validation data. It's actually been compared to gold standard JMAR, and it has excellent correlation with JMAR. It also has developed its own UK normative grip strength data set, and there's data collection in progress for the US populations, I believe. So when you're using GripAble to maximize sensitivity, what you do is we squeeze, and you see there's a little button in the top. Okay, and it turns it into our isotonic mode. And in this mode, it can detect changes in grip force, as small as 60 grams all the way up to 90 kilograms. Um, and that kind of range is invaluable, especially when you're working with patients who are really weak in early rehab or managing pain or spasticity, where even small gains are clinically significant. The other great thing is GripAble is really robust. They've done drop test from shoulder height, and GripAble still maintains its accuracy even after repeated impacts. So, that's really reassuring when you're in a busy clinic. We've all done it. We've dropped, for instance, our JMAR, and we know we've got to send it off for calibration. You don't need to be doing that with a GripAble. There's actually a part within the app where you can just recalibrate the settings, the device, to make sure it's still as accurate. Within the platform, we've got 6 structured grip tests. We've got quick grip, sustained hold, endurance, rapid exchange, grip test. And each of those tests, as you can see from kind of the images on the screen, have visual and there's also verbal on-screen instructions, which help standardize your approach across the different therapists and sessions. And like I mentioned, these protocols are aligned with the ASHT testing recommendations. And you can see from that kind of like that top image there, it's really easy to walk through. So it's particularly for your novice therapists or people just starting out with grip testing as well. It sets a nice kind of standard right from the beginning. Equally, if you're getting patients to do remote testing, and we're going to dig into that a little bit more, they've got very clear instructions about the position that they need to be in. Okay, next slide, please. Okay, so here, oh, can we go? That's it, lovely. Thank you. Here you can see some screenshots of some of the grip test results that you can get within the GripAble app. So these kind of the first 4 that you can see, these are what you get immediately after doing your grip test. You can see we've got the multi-positional grip test at the top, the rapid exchange, sustained at the bottom, and then endurance. And what's really useful is that the app automatically calculates the key metrics, like the average grip strength, standard deviation, and then it does left-right comparison. So it's really nice. It saves time, stops you getting out that calculator, and also making any errors, reduces those errors. And what I love is the graphs. They provide excellent visual feedback, showing things like time to peak force, hold duration, and force variability. And these are really useful, not just for you as a therapist, but for patients in understanding like what's happening. It's not just the how much, but also the how well. So we're capturing more than just maximum grip strength. You're getting insights into fatigue, control, consistency, and also any asymmetry between the hands. And then when you're ready, you can actually, as you can see, you can email the results after each test. But if you've done, say, like a battery of tests, the platform will pull all the tests together, and and you can see that on that larger image to the right. And the platform pulls all the tests together into a comprehensive downloadable report. And you can put that in your, it's a PDF, and you can put that in your documents, and it can be emailed to yourself. Okay. Next slide, please. Okay, so another really great feature of GripAble is that you can set daily goals in reps or minutes, and you can track your progress. And the progress gets tracked over 70, 30, 60, and 90 days. And you can see here we've got simple motivating visuals, and that patients can compare their performance to the targets. So you can see on that bottom image for grip release, that is their goal, that blue line, and then then we have the graph behind with their achievements. And this has really helps them stay engaged and see their progress and how well they're doing. And obviously for us as therapists, this data is great because it supports better clinical decisions. We can start spotting trends, we can adjust goals, and again, we've got nice clear reports for documentation or even for your multidisciplinary discussions. I also really like, that it encourages that shared goal setting with clients. So, and we know that improves adherence and outcomes if we can do that. Okay, next slide, please. Okay. So why does it work? What is the science behind GripAble? GripAble is grounded in well-established rehab science. So both neurological and musculoskeletal rehabilitation are underpinned by the same core principles. So we've got repetition, task-specific movement, and feedback-driven progression. And we know from wider literature that functional recovery, whether strength, control, or coordination, requires high volume, meaningful activity. But in practice, many patients fall short of that intensity. I think we know that from stroke rehab studies, patients in standard care may complete fewer than 50 active repetitions per session, which is far below the dose associated with neuroplastic change. And GripAble helps bridge that gap. I have played one of the games and have been able to deliver up to 70 grips per minute. And if we're doing that for patients, we're helping them to meet those evidence-informed targets, which are around 300 minutes of purposeful upper limb activity per week. GripAble also leverages gamification principles, and that's your goal setting, moving through levels, real-time feedback, and tracking, as well as rewards. And all of these have been shown to improve engagement, motivation, and adherence across physical and cognitive rehab populations. And I have got a list of references at the end of the presentation, or I'm sure we can have them sent out to you if you want to see more of that. Lastly, the activities are all designed around the concept of flow. So we all know that experience, that feeling of when we're kind of immersed in an activity and we kind of lose track of time. And that really helps to sustain attention and reduces frustration, particularly in patients who may otherwise be disengaged or feeling a bit fatigued by that repetitive training. Now, it is important to say that the direct evidence base for GripAble with specific diagnostic populations is still emerging. So we need to draw on these kind of broader rehab evidence base, rehab evidence base, like we said, particularly for the motor learning, neuroplasticity, and gamified therapy. And I think if you go to the GripAble website, they have all the research published on their site. Okay, next slide, please. Okay, so we're just looking at now with different populations. So hand therapy. So I suppose this is my bread and butter. And I'll be honest, when I'm using GripAble, the first thing I reach for, especially when I need objective data to support return to work planning, or particularly with like functional capacity reports, is I go for the grip testing. As you saw, the graphs and metrics are really impactful and really helpful when I'm trying to justify funding, justify rehab goals, or even like phased return to like work recommendations. When I'm kind of in session in clinic, I particularly would give a shout out to the sustained grip test, which gives you so much more than that single strength kind of value. Particularly like when we're thinking functionally, it helps you to build a much better picture. We can look at how long someone can hold force, how well they modulate it, how quickly they fatigue. So it reflects like everyday tasks better than your single maximum grip test. So like holding a kettle, carrying a bag. If a patient's reporting difficulties with these tasks, but is still producing a decent maximum effort, that sustained grip can reveal what's going on underneath, whether we're talking poor endurance, variable control, or they might even just have some like fear-driven offloading happening. When it comes to treatment, what's helpful is that you can progress without relying on trial and error. So if we think about our putty or even hand grips when we're doing like hand strengthening, it's binary. Same with if we're using TheraBands for our wrist extension flexion. Sometimes we're often jumping from one resistance to the next based on that subjective feedback. But because of that lovely calibration aspect of GripAble, we can scale up more precisely. So that's really useful if you've got someone who's got low confidence or symptoms that flare really easily. And we can make sure that they're working at the right level without kind of tipping them over the edge. I also really love GripAble for people who are pain aware or hesitant to move. Focus can shift from kind of doing exercises to achieving a task, which often lowers resistance and helps reduce kind of guarding. Especially in that early stage rehab, it can make or break that patient buy-in. In terms of session structure as well, it fits really well. So you might use it as a bit of a warm-up to get people going, to kind of get some activation before a functional task, or you might drop it in at the end for a bit of a volume push of those repetitions, and it doesn't feel like such a slog for your clients. Last thing on this, I would say I really love the device shape of GripAble. It mimics the size and shape of things like bottles, rails, hairbrush handles, screwdrivers. So the movements you're reinforcing can translate quite nicely to those kind of ADLs, those activities of daily living. With regards to the games, there's so many that you could use, but I suppose again, my shout out would be to highlight Space Shooter or Pufferfish game, and that involves some wrist movements combined with. Let me take this off. Oh, hold on. So we've got the wrist movements combined with some kind of some gripping as well. And that's great for like those wrist instabilities or building that dynamic control when we're doing some wrist training. Next slide, please. Okay, so in neurorehabilitation, we've already touched on knowing that meaningful recovery relies on that high volume, task-specific movement, but delivering that intensity consistently in practice is challenging. Neuro rehab, you're going to have patients with fatigue, fluctuating attention. You might also have some low engagement, and that all is going to limit how much your patients are realistically able to do, especially again in those early stages. But with GripAble, you can get that high repetition practice without relying solely on therapist input. So if you're thinking about like in a busy inpatient ward, you may be able to leave this at the bedside for a patient to practice, or even kind of pass to your rehab assistant to do the work with them. Or equally, if you're working in the community, this can be left at home with your clients to practice. So you can do some kind of in-session work, and then they can do some kind of away from that therapeutic session. The activities also provide like functional context, a bit like we've talked about with hand therapy, which helps with both motivation and consistency. We've got Circus Escape here as a video. Perhaps we could play that. So Circus Escape is centered around some grip and release. And it's a useful focus when working with patients who have increased tone, where finger extension is often more limited with flexion. So they really have to work on that release. So releasing to get that bear moving. So here we kind of can work on that finger extension, but we can also work on getting high reps with that bear. And you can see here, when we're talking about those like rewards and the scoring, we can see we've got a time score and done it really well. And we've got the 3 stars. Okay, so because the device is highly sensitive to small movements, it's really accessible for your patients with really limited active range. And it allows you to involve patients really early when voluntary movement may only be emerging. And we know that early activation, however small, can contribute to better outcomes. The structure and feedback also help reinforce motor patterns. We've got visual and auditory cues, and we get some immediate information about movement quality. So that reduces that need for us to provide verbal cueing, allows patients to do a bit of self-correction. And this can be useful if you've got attention or cognition, when attention or cognition is affected. And again, for us as therapists, we have all that lovely objective data, how many reps, how many minutes have been played, and it gives you a clear picture of that progress over time, which can help with goal setting. And again, those wider kind of discussions with MDT and progressing treatment. Okay, next slide, please. Okay. So pediatric. For those of you who work with pediatric clients with kids, you'll know therapy isn't fun. If therapy isn't fun, you've lost them before it's even begun. So GripAble is a great fit for pediatric therapy because it turns upper limb rehab into something they actually want to do. Games are colourful, responsive, and simple enough to get started quickly. But they're still supporting those therapeutic goals. We've got a video here, Pigeon Hunter, which is ideal for building repetition. So if we could show that video. Hold on. And there you saw we've got various levels that you can work through, and it gets harder through those levels. So here, every successful hit of that pigeon is the result of a grip and release action. And the arrow here, again, a bit like we were talking about with circus escape, does not happen until the fingers are released. So we can look at kind of initiation. The child can wait to shoot the pigeon, or we can just do those high reps again. So again, we're supporting that motor learning through kind of volume and rhythm. We've got other games that are going to be focused more on sustained grip and controlled pressure. And those skills are going to translate directly to like functional tasks like holding a pencil or managing buttons. Because of that calibration function and that sensitivity, if there's only a small amount of finger movement or very light grip, the device can be calibrated to match that. And even thinking about your pediatric population, if you're wanting to work on a bit more of your fine motor, we can even play those grip and release games just with fingers. Okay. So we still get that challenge, it's still achievable, but it kind of we can work on those finger movements. We can also think about blending GripAble more easily into the broader therapy sessions. So like we've talked about before, you might want to start getting the hand activated before moving on to activities like threading, scissor control, or handwriting. If you've got kids who struggle with concentration or fatigue, the game format can help them get more practice in without it feeling like work. And depending on the goals, sessions can be run in supported sitting, prone for trunk extension, or side lying for comfort. And so thinking about the device can fit well into more sensory motor circuits and task-based activities where the hand is part of a bigger picture. And again, we have all that lovely data being collected in the background. And it's great to be able to share with families, teachers, or even part of EHCP reviews. Okay, next slide, please. And then last but not least, we have the using GripAble with older adults. Now, when you're working with this group, we often have quite a complex presentation. There might be frailty, we might have some mild cognitive impairment, maybe some low confidence or motivation, or people are just a bit deconditioned after illness or a long hospital stay. And I think this is where GripAble is a bit of a quiet superpower. It can be used kind of as part of a broader kind of multimodal like plan. For example, in those like early reconditioning phases when functional use of the hand isn't quite there yet, or the patient's just not that keen to engage, you've got somebody saying, I'm too tired, I'm not sure I can manage that, or I don't really do tech. Put on a game like Balloon Buddies, give them a little feedback and a score to beat. And often we can get that kind of narrative, that tone of that session to shift. Because of that calibration, we can offer movement that's safe and achievable, even in your more frail, anxious, or kind of those fluctuating patients. And that might include some gentle activation while they're still in bed, or early motor loading before they're ready for that ADL practice. I also think it's quite nice as a bit of a primer to do a short game to activate that wrist and hand before you're working on dressing or kitchen tasks. And it's a real subtle way to build in strength and coordination, especially when that endurance is low. But the other really great thing, and this is going back to our grip tests, is that grip strength is a really strong biomarker, a really strong clinical indicator. So we've got multiple studies out there. Most studies and reviews that have shown that grip strength is linked to all sorts of outcomes. So mortality, cardiac health, hospital readmission, cognitive decline, sarcopenia, and even future disability. And so consequently, grip testing is now part of like several frailty screening tools and geriatric assessment pathways. So if we're testing grip regularly with something like GripAble, we're not just tracking rehab, we're picking up broader trends, and that might mean spotting early signs of fatigue, identifying someone who's plateauing, or flagging up someone who needs a normal referral, maybe for nutritional review, or to the MDT for falls prevention. Okay, next slide. Okay, and so how can we think about integrating GripAble into practice? We've talked a lot there, and I think introducing new tools into practice, especially digital ones, tech ones, can feel like a really big shift. But it is important to remember that GripAble isn't here to replace your clinical skills or your hands-on technique. It's just an adjunct, something to complement what you already do, not compete with it. We have to think about it in the same way that we would with therapy pegs. The difference with GripAble is you're getting structured progression, you're getting lots of feedback, and lots of rich data to support that clinical reasoning. And again, it's information that you can share and open up that dialogue with your clients as well. So let's think about some like kind of practical ways that you can start to embed it in your everyday sessions. It's actually the last thing on this slide, but the first thing I'd be saying is get your team on board. Start with an in-service or an informal kind of team demo. For those of you who are kind of early adopters of tech, you're the great people, the great ones to kind of lead this. Reach out to Chris and the team to get a demo set up. There's also lots of videos as well if you want to see more about the games or the setup of GripAble on the Kinetech or the GripAble website. So get it in, try it out. What do you like? See what you like. What fits your caseload? What might be a challenge? It's good to look at the good, bad, and ugly and kind of plan for those things. And if you've got a multidisciplinary team, if you've got OTs, physios, rehab assistants, that shared familiarity helps to ensure consistency for patients and build confidence. So if you feel confident using it, then you're more likely to reach it for practice, and your patients are more likely to feel confident using it. And you're going to be able to explain a little bit more about it if it's your team have adopted it. I'd start small. So just begin with 1 or 2 patients or clinical scenarios where you think it fits. So you might have like, I don't know, post-op grip strengthening or motivation issues. That's a really good one. Your pain conscious patients or just fatigue limited, like also just try it as a the hand, build that engagement, or as a cool down to just reinforce movements you've just worked on. And those small wins can shift how patients perceive exercise, especially if you find traditional approaches a bit repetitive, effortful, or a bit boring. The other thing is you can use it at home, and we've touched briefly on that. You can use it at home to extend rehab. So GripAble is ideal for patients who can't attend in person regularly. So if you're working in a rural area or you've got patients who are managing fatigue or parents juggling care needs, it's really great for them. So I would also practice in clinic first. Get your patients used to playing the games, set some goals together, and then set up a home program. And you can track them remotely. You can look at how much they, like we've talked about, how much they have played, their reps, what games they've played, what do they like, what do they not like, why and it opens up that dialogue about why haven't they been able to meet some of those targets, okay? Rather than us, we all have those patients where they say they've done their exercise, but you're a bit unsure whether they have. It creates a bit more transparency. So we can then do a bit of early troubleshooting and kind of reduces those dropout rates if we can kind of open up that dialogue. And then, like we've talked about, boost engagement through those shared goals, set goals with your patient, minutes, days, reps, or you can even just get them to be able to work up to a certain level or improve an accuracy on a certain level. Or you might even get them not playing the games, just get them to improve their grip testing, okay? And this allows patients just to beat personal bests, and that can boost confidence and support adherence. Again, particularly if we've got those low motivation cases. I also really like just gives patients some ownership over their rehab as well. It helps kind of sometimes give them the language to talk about their own rehab. So I think that's it's question time now. Um, do we have any?
I think, can you hear me, Liz?
Yep,
Yeah, so I've been looking and we haven't had anything come through. So obviously it was a very complete,
comprehensive. Love it.
comprehensive presentation. For those of you who can't think of any questions at this moment, anything that you think of subsequently, you can contact us. That's not a problem. Um, just please please do that. We're really happy to take questions afterwards. Someone said Keely can spotlight me. I've got my video on, but I don't seem to. Can you see me, Liz? Or there we go. Yeah, I was there all along. I was honestly, I was here. Yeah, so do come back to us with any questions. Picking up on a couple of bits that Liz said, just to reinforce a few messages. Um, a lot of information around training is on our MedFact Learning Centre, which is actually where the this webinar will appear subsequently. So we use that as our training portal. So information and training on how to use the GripAble and to have all sort of previous webinars and existing webinars are on the MedFac Learning Centre, which is medfaclearningcentre.com. We also have a trading website as such, which is our Kinetech website. We have a couple for international customers. It's kinetecinternational.com. And for UK customers, it's kinetechuk.com. And on there, there's also information about GripAble for purchasing it for end users, and also for there's some videos on there as well about how that can be used. So we try and give as many options as possible. The one thing I will flag there as well, which I do think comes back into what Liz was saying, is that rental is something that we really encourage, and GripAble is available for rental. So if you have that cohort of patients who may be relatively short term, they need some assessment and want to be doing the games, but actually they don't want to buy something, then we do have a rental option. So that is really something to seriously consider with your patients and promoting to your patients. So if you have a grippable handset and can show them how to do things, then they can go away, you can link into them, but they can do that via rental as well. So that's done so people don't have to fork out for to buy one straight away. And also, as Liz mentioned, we're very much in a partnership with GripAble, but we do all of the sales and marketing now. So if you do go to the GripAble website, which is gripable.co, you will find a huge amount of information in there, including a lot of clinical studies, which have been touched on by Liz, but not into great detail. And that may be a feature of a future webinar. But there's a lot of clinical information in there that you would find useful. So don't hesitate to use that. But if you want to think about actually having demonstrations or look to purchase one for your business or your department, then obviously come through to myself and Keely in the MedFac team, and we'll help you out. We'll be delighted to do so.
I think we've had
So,
some questions come through now.
okay. Oh, good. Okay, that sounds good. Oh, the Q&A, there's a few come through. Okay, so first one, is the grip diameter changeable for patients with limited finger flexion range?
No, I mean the size is set to your JMAR 2. So for really small hands, you might find that a little bit harder to grip. But I would say I think from around kind of age 7 upwards, I think that sits comfortably in the hand. Yeah, but what I would say is even for your smaller kind of patients or those smaller hands, when you compare against to again get to the grip of sorry to the JMAR, that weight is going to make a big difference as well. So that's something also to consider.
Okay, thank you very much for that. We've had someone's actually put, I think it's more of a statement. Someone's said that really helpful. I'm thinking of using GripAble for my MSc Neuro rehab essay for a treatment approach. So I think that was more of a statement, but that's brilliant.
Brilliant.
Really,
Go for
really
it.
nice that someone's come on and done that. That's great. Someone has asked how it works if we would like to use the NHS Trust I loan or full purchase. So yeah, we can follow up with you on that, and we'd certainly have no problem doing a trial. So if in your department you want to trial it, see how you can get on with it, then we will absolutely be delighted to follow up and support you with that before you purchase. We have someone who's asked about a CPD certificate. So what we have at the end of this webinar, you can go into the MedFact Learning Centre and you can download a certificate for your file to say that you've attended this. So there you go. And then we've had someone says, my chat says chat disabled, just to let you know. So I do apologise for that. Not quite sure what's happened there, but obviously we've picked you up in Q&A. So that's maybe why no one was appearing in chat and everyone was in Q&A. So I do apologise, and we'll follow that one up in future webinars. Okay, so I'd like to thank you all for attending. Oh, I've got one last minute. Do you have links to the previously mentioned webinars? Sounds rather interesting. Yes, Keely can follow that up with you and give you all the links for the webinars. But all the webinars are held on our medfaclearningcentre.com. So if you follow that, then you'll see everything, and it covers lots of different areas, hand therapy just being one of them, but we also have a lot on orthotics and so on as well. So please look in there. We've got splinting webinars, casting webinars, so lots of really good information. So thank you all of you for attending, and most importantly, thank you, Liz. That was really
Thanks,
great, really
everyone.
informative, and I think obviously from the questions we got is lots of thought going into using GripAble going forward, and I'm sure we'll be repeating this and doing another GripAble presentation and webinar in the months to come. So thank you, Liz. For everyone else, thank you very much. Have a great evening. We're going to be doing another webinar in approximately 4 to 6 weeks' time, and that will be a splinting webinar. So we just haven't got the date finalised for that, but keep your eyes out, and we'll let you know in due course. So thank you very much. Have a good evening.